Alrighty, everyone. Welcome back to Clinically Speaking, Ivy Rehab's monthly live podcast here on LinkedIn, where we dive into important conversations shaping the future of rehab and patient care. I am your host, Bismarie, and I am so glad that you're here with us today. This month, we're exploring the interdisciplinary model of care in the pediatric clinic, what it looks like when speech, occupational, and physical therapists come together, and how collaboration not only strengthens our teams, but also drives the best outcomes for patients and families. We have an incredible panel with us today. We have Kate Dalman, a speech language pathologist with more than 20 years of experience and the leader of Ivy's Pediatric SLP residency program. Brittany Bosley, a board certified pediatric occupational therapist who founded our pediatric OT residency program in 2022. Jill Owen, a pediatric physical therapist and now director of the pediatric PT residency program at Ivy Rehab for Kids. And Leah Burke, our vice president of talent acquisition, who has over 20 years of experience building strong clinical teams. Together, we'll unpack what interdisciplinary care really means in practice, the impact of mentorship and residency programs, and how bringing the right people onto our team sets the foundation for everything we do. And stick around until the end, and we'll tell you when our next episode is. So, kicking things off, for those who might not be familiar with what exactly is an interdisciplinary model of care in a pediatric clinic, and how does it differ from a multidisciplinary approach?
Yeah, so I'll jump in right here. Interdisciplinary approach versus a multidisciplinary approach really are two different things. When you're talking about a multidisciplinary clinic, it's really just talking about how different disciplines sort of live together in one space, right? So everybody is in the same clinic treating their own kids, but switch to the interdisciplinary model of care is really when those disciplines start collaborating and everyone really kind of plays off of each other and works together more as a team approach.
And then Kate and Brittany, do you guys want to add anything to that answer? You think Jill hit the nail on the head with that one?
I think she got it. I'll just add, I think interdisciplinary is just an amazing way to kind of work on therapy and address all of the concerns that our families have. We all see the same child through a little bit of a different lens. And so that's the beauty of not just our clinic being housed in that one space with all PTOT speech and sometimes ABA, but also when we all share our goals and can collaborate, that's when we really can make some big changes and really have that meaningful change with our patients and their families.
Yeah, they both nailed it on the head. I don't know any more I can add to that question.
Awesome. Well, thank you. And Jill, what makes Ivy Rehab for Kids interdisciplinary approach stand out compared to other clinics or therapy providers?
Yeah, that's a great question. I really think that it starts with all of Ivy's clinicians really being at the top of their field. Ivy places a huge emphasis on bringing in strong clinicians, strong clinical leaders. And then that combined with the emphasis that Ivy places on clinical education, it really just puts the level of care that you get at Ivy Rehab for Kids, above everyone else. You start with these really strong individual clinicians, in each discipline, and then you're in an environment that doesn't just talk about collaboration, but it promotes it. Ivy Rehab for Kids really values it. And so that combination, of all of those things really puts the level of care that you're going to get at Ivy ahead of everybody else.
And Leah, I want to direct a question to you because Jill brought up, finding those strong clinical leaders. So when you're in that recruitment process and you're either interviewing or trying to look for those typical, clinical leaders, what do you look for?
So for clinical leaders, we really want someone that kind of leads from like a servant heart. Obviously, they need to be very strong clinically. And we also rely on networking. So good clinicians know other good clinicians. And some of the best therapists and clinicians that we have found have come from referrals from our clinicians that currently work at Ivy. So it's all about knowing who's in your market, knowing those good leaders. And one of my favorite sayings from my early days in recruiting is, good people beget good people. So it's really focusing on that network and collaborating within your own network.
Oh, I love that. That's an amazing saying. Thank you. And then kind of going into more role specific and co-treatment insights, Kate, I want to direct the attention to you. So as an SLP, how do you collaborate with OTs and PTs in a typical week in the clinic?
Yeah, thanks, Biz. So I think this is what I love to always talk about is the collaboration between PT and OT and speech, specifically from a speech lens. A lot of my experience in the clinic was with feeding and with babies and the mother-baby dyad, and even integrating some, when we pull in OT for some co-regulation, some bonding, some of those state control things that some of these babies and moms might be bringing in with them. And then a lot of times for PT, we'd pull them in for some torticollis or some postural control. I think sometimes in school, we're also focused on our specific discipline, but we forget, like, you have to be able to sit up and breathe, to be able to speak, to be able to eat. And so that's kind of where we can all collaborate on some of these patients. And a lot of times, we're in the gym together, which if anyone's been in a pediatric gym with PTOT speech, it's a little chaos, but we love it. And, we're doing some obstacle courses with OT and PT, trying to work on that control, that motor planning for speech. Maybe we're seeing them for apraxia, where we might have the same motor planning challenges as some of our smaller muscles up in our mouth. So it really just kind of depends on that patient, obviously, for individualized treatment. But really, like I said, we can kind of play a lot off each other's strengths. If I have a child that's well regulated, that has OT first, me as an SLP, I'm like in my happy place because we can get what we need to get done. And then, if I need to pull in PT, if we're having a difficult time with some postural control, core strength, coordination. Again, if we have there's a lot of diagnoses that overlap in terms of coordination and things like that we'll see in PTOT, and again, seeing our smaller muscles for eating, drinking, and breathing for speech.
Okay, great. Thank you. And what do you see as the biggest benefit to your patients when you work together in this way?
I think what we're really looking for across all disciplines is we really want to make the biggest impact we can on these patients and their families outside of the walls of our clinic. Mm-hmm. So we're all very comfortable in our clinic walls and, within our treatment rooms, but really trying to focus on what is important to this child and this family to, again, make that meaningful change outside. That's really what we're focused on. And we all know when we all integrate together and we have this interprofessional form of practice and it kind of collaborates off of each other, we each pull in our strength and then we really focus on getting that best outcome possible. So it's not just what we're working on in speech today or what we're working on in OT or what we're working for PT. How can we all work together to get that better outcome and support the child holistically and their family, again, outside of our walls, because that's really what we want.
Oh, that's amazing. Thank you, Kate. And then shifting gears to OT, Brittany, I want to ask you, the co-treatment between OT and SLP is really a big part of our conversation today. So what does a successful co-treatment look like to you?
Yeah, great question. If I could have my way, I would have a co-treat with all of my kiddos that receive speech, but I would have it in the second half of our sessions, because so many times we as OTs are working on that regulation piece. So that child is coming in wound up or maybe just dysregulated from the day. And so we're utilizing our strategies and our interventions to get that child in that optimal state of arousal. And sometimes that can take up to 30 minutes. And so I can't even tell you how many times that the speech therapist has left the session, at their time, and they're like, oh, I felt like I could have gotten a little bit more from this kiddo. And man, that kid started talking like nothing, and saying all those phrases, saying what they wanted them to say in that first half because they were regulated. And so it's quite funny. We have a running joke in the clinic. I'd be like, hey, so and so, said, I want the bubbles 10 times, and the speech therapist her mouth would just open, just like, what? Like, so a successful co-treat is where that child is regulated, utilizing their OT strategies and techniques so that the speech therapist can, get in there and do the things that they are needing to see from that child, and we're both benefiting.
Oh, that's beautiful. Thank you. And I think that's great. And Kate, I want to ask you, like, what are some success stories that you can think of when you're thinking of SLP and OT and those kinds of like rewarding times when you see a patient kind of like that, that light bulb switch?
Yeah, so I think as SLPs, we get like maybe a tiny little bit of OT related content in grad school. Like we know that deep pressure might work, we know the swing might do some things, but we don't really know the full extent. So kind of being able to pull an OT and be like, hey, what do you think of this kiddo? And then a lot of times when we do get that, where they have OT that first half and speech the second half, by the time we get to them, they've been on the swing, they've been doing heavy work. So it's not just us kind of like hoping that we can make a good outcome, but it's really with OT and their lens coming in with their expertise. So we're better regulated, like Brittany says. Then we start talking, we start engaging, we start interacting with the other kiddos that might be in the gym. I think that's really when we really start to see that benefit and really can see that where it's not just about, again, like what I'm working on and what you're working on, but how can we get this child in an optimal state of arousal to be able to participate in some of the things that we want to do. And I'm talking about like, obstacle courses, older kids, but then with the babies too, when OT can work their magic with the babies and the moms and the regulation, like it's just a beautiful thing. And everyone leaves feeling so much more supported and so much more connected, which is really what we're looking for.
That's amazing. Thank you. And we do know that not all states allow co-treatment. So, Brittany, if you are in a state that doesn't allow co-treatment, what are some other ways that you can still be a part of an interdisciplinary plan?
Yeah. So a lot of times, we will have that child receive one service first, and then right on the back of that, have that next service. And so that handoff, that critical piece of that therapist handing off that child to the other discipline is that key point to say, hey, mom said that he didn't sleep last night. I worked my session and we really worked on regulation, and I think he's in a good spot for you. Or, hey, the medication's changed, or whatever it may be that we need to communicate that we might be doing in session if we were together, we're doing during that handoff, and making sure that the parents or caregivers are aware and with that process as well. And then with, IV specific, we have clinician workrooms. And so everyone is working together, during lunch or, before or after working hours. And so, you can always try to snag your PT or your SLP if they have a no-show or a cancellation, or even just before or after work, hey, what's going on with so-and-so, utilizing that time really valuably to get kind of the most out of the time we're together, right? And no one wants to take work home. So utilizing those times in between sessions to just quickly catch up. But those are all great ways that we can connect with one another if co-treatments aren't an option.
Great advice. Thank you. And we spoke about how OTs work together with SLPs, but I want to touch a little bit upon PTs now. So, Brittany, how do you incorporate physical therapy goals into your occupational therapy work?
Yeah. So, it starts with that collaboration, right? So, meeting with the PT, seeing what they're working on. And there's a lot of great ways that we can do that. So, if that PT really is working on some core strengthening and some postural control, can we have that child sit on a therapy ball during our fine motor tasks, like doing a puzzle or coloring? Balance and coordination, if that's what the PT wants to focus on. Can we set up an obstacle course to go and retrieve those objects that we're needing for dressing or for handwriting or coloring, like go down the balance beam, pick up the red crayon, come back, or moving between different stations in the room or the gym, crawling, jumping, to access different types of intervention things that we might be utilizing. So it's a really great way to, incorporate. It's a, easy when you're saying it right now, but hopefully these suggestions can help someone out there who might be needing some PT interventions to utilize during their OT session.
Great. Thank you, Brittany. And then sticking with the PT subject, over to you, Jill. So physical therapy often focuses on gross motor skills. How do you make sure your goals are supporting speech and fine motor progress as well?
Yeah, I think lucky, for us PTs, a lot of the PT strength, coordination, balance stuff, and gross motor skills just sort of naturally supports speech development, and like fine motor control. But Kate and Britt already sort of touched on it, but a lot of times PT, regardless of the kiddo in front of us, we're looking at core strength, we're looking at postural control, in obviously different positions depending on the age, or ability level of the kiddo. And everything really stems from that, right? So you need good core strength, postural stability, good bilateral coordination to coordinate any of those fine motor muscles that you need for handwriting, dressing skills, self-help skills. And then same thing for speech too, you know, putting those speech sounds together, the coordination of swallowing, you know, moving food around in your mouth. It's all really related. And again, like I said, you know, lucky for us PTs, we're usually working on that stuff anyway. So it's just kind of natural to support those other goals. But then, you know, really making sure that you're communicating with the other clinicians who are on board, right? Like we all want what's best for this kid. We want what's best for the family. We want things to be really meaningful for them. So if we can incorporate other aspects of, you know, things that they're working on, or maybe things that they recently mastered, you know, to throw in some like really positive things in there for them, then, you know, it's pretty easy for us to do that as PTs, just to make sure that, yeah, we're addressing the whole kiddo.
Great. Thank you, Jill. And can you share an example of when collaborating with an OT or SLP changed your treatment plan for the better?
Oh yeah, I can I can think of a bunch. But yesterday, even specifically, I was in a session with a cute little. She just turned 1, and she was having a hard time with certain gross motor skills and certain movements. And you know, I had kind of pulled out all of my PT tools and was still kind of stuck. So luckily, one of the OTs in my clinic had a cancellation at that time. So I stuck my head out into the hallway and asked her if she had a second to come in. And I think she sat in the session for maybe 10 minutes, and just those 10 minutes were so valuable. She educated me on a few things. She pointed out some things that I hadn't noticed yet. And she was super helpful in educating the parent too, because parent was in the room. Um, and I mean, we're already on kind of a better trajectory after just those 10 minutes with her. So sometimes that's all it takes. And just super, super grateful for not only the time to be able to do that, but just working with really great clinicians who are willing to do that too.
Oh, that's amazing. Thank you so much for sharing. And then, Jill, I know ABA therapy is a big component here at Ivy. So, how do the rehab disciplines collaborate with ABA providers to support the whole child?
Yeah, that's a great question. I mean, I'll be honest, it's pretty similar to, you know, coordinating between OT and PT and speech. But again, it all comes down to communication. Um, and, you know, just kind of a level of like mutual respect for what everybody does. Realizing that everybody involved in a child's care wants what's best for them, wants them to reach these goals, wants their families to be, you know, in a better place with different things. So just kind of knowing that and understanding that is like the foundation, and then really making sure that you're making time and committing to really consistent communication is especially important with our ABA programs. You know, kiddos can really change day to day, hour to hour. And so making sure that you are communicating those things to the correct people, you know, in a appropriate amount of time is going to be really important, just to measure or to you know, have a successful day, session, whatever. And then just kind of like bigger picture, you know, really carving out the time to make sure that the ABA team and then the you know, the therapy team are coordinating and collaborating, so that, you know, maybe ABA is implementing some PT things during their day for their gym movement breaks, or you know, if a kiddo is maybe working on handwriting, you know, making sure that they have opportunities within their day in ABA to do those things. And it really just benefits everyone, right? Because then ABA has some really child specific things to put into their different programming, and there's better carryover for the kiddo with those different things that they're working on.
Yeah,
So you,
I'll chime in there real quick. And, you know, I think it's important to stay curious, right, about other disciplines. You know, it's easy to get in a silo of, you know, my discipline is the best discipline. But, you know, with these kiddos that we're seeing, you know, it has to be this type of approach where we're all collaborating and all engaging together, because that's what this child needs. And so staying curious, seeing what's going on, if you have a cancellation or a no-show, maybe going over to the ABA side of your clinic, or, touching base with the ABA provider, saying, hey, like, can I just come observe this friend with you and see how they might be with you versus with me? And, sharing those things. And so, like Jill said, it's about that mutual respect that each of us have something in the game, but we all are there to benefit the child.
Thank you, Brittany. And I know, Jill, you mentioned an emphasis on communication and how important that is in this process, especially within the team members. So I wanted to ask you, can you give an example of what that may look like in clinic?
Yeah. I mean, gosh, it could look like a few different things. But I know specifically on several of the clinic teams that I've been on, we really make it a priority to schedule a chunk of time where everybody, ABA, PT, OT, speech, can all sit down and meet and talk. Sometimes we bring an agenda and say, hey, we need to talk about this kiddo and this thing. Or sometimes it's just kind of an open discussion. Hey, how's everything going? Is there anyone who you have any questions about? But really just making the time and the space for that conversation to start is really, I think, all you need to kind of kickstart that communication.
And is that typically brought on by the clinic director, or is that even organized by the various clinicians in the clinic?
Yeah, so every week there is dedicated time in the schedule, to have staff meeting time, kind of talk about clinic happenings. And so as a clinic director on both the ABA side of things and the PED side of things, it's really the responsibility of the CDs to kind of come together and say, okay, at what point this month, is a good time to come together and make that the focal point of the meeting instead of kind of just a line item, on a really long agenda. So really, again, making sure that the clinic directors are carving out that time and, allowing the space, I guess, for everybody to communicate and have some say. And again, just kind of cutting it short to just one line item.
Great. Thank you, Jill. And then Brittany and Kate, I see you guys there agreeing. So I wanted to ask and see if there was anything you wanted to add from your experience when it comes to communication within the clinics and those, clinical lunch times that we had discussed.
Yeah, I think to go off of what Jill said, it's really important to make that time and hold that space for that, because we all know everyone's busy. For some of our OTs, we're seeing 10 kids a day. Speech can be up to 20. PTs can be the same as OTs, 10, depending on how timeframes look. So we have the potential to be very busy, and that might kind of fall off the plate, but I think can continue to kind of bring it back to that and keeping that paramount and holding that space. I know when I was a CD, we had every Thursday was our professional time. When we do lunch, I'll hang out in the gym. Everyone loves to relax for like a hot second, so it feels good to just sit down on some of the crash pads and find a little comfy spot. And then, like Jill said, just hold that space, talk about those patients and their families. I know for a lot of, depending on each discipline, like I would always get a lot of kids like not talking, but then they come in, you're like, oh my God, I really need some PT in their life to like be able to like attend to play and do other things. And that's also a great time to be like, hey, have you seen so-and-so? Like, what do you think? Have we thought about this? Because a lot of times, again, what they might come in for initially, we might then have that time in those discussions to talk about the potential to kind of bring in another discipline to kind of help support us again to get that better outcome. And so I think that's just really important. And it was something that I did in my clinic. Plus, it's just a great time, if you're having fun at work, which we're all pediatric therapists for a reason, we all have fidgets, we all have spirit weeks, we all have the fun things. And to be able to have that time and talk about your patients and your families then really brings you closer to the team. And then it's not so much like work, like you're hanging out with your friends doing cool things for these kids and their families. And that's really where, I think it makes it feel just a lot more fun and engaging, and everyone's just there for the right reasons.
Yeah, I mean, I'll echo what both Kate and Jill said. It comes down to communication, and even during those lunch times, like setting some time to either go outside as a team and go for a walk, or sit outside in the sun and get some vitamin D. But including your PC in that meeting too, they're a vital part of the team, and they don't just schedule patients, right? And so having them as part of that communication team, so that they are in the know, like, and they can help, drive that message home that, hey, we want to see your child succeed and do great things. So let's get you on the schedule again. When they're bought into to the kind of what's going on behind the scenes in the clinic, then it can make it a lot easier, because a lot of times they're the ones that connect with the parents the most in that face-to-face. And so you really can leverage them as a great tool to increase, patient adherence to those plans of cares as well.
Great. Thank you so much to everyone's answer. And I love to hear so much about, the importance of growth and development around Ivy, because that is one of our main values. So, Leah, I wanted to have you chime in a little bit about the importance of our culture at Ivy and our values, and how, how we want it to be shown across everything that we do in clinic, outside the clinic, and every position. So I want to give you the floor there.
Absolutely. Thank you. Yeah, the Ivy culture is special and it's real. And I joke that, I drank the Kool-Aid, and I feel like most of the people here have drank the Ivy Kool-Aid, because the Ivy culture really does show through in the day-to-day interactions that I have with my team, with various clinicians, with other departments. And I know we're talking about an interdisciplinary model of care, but we also have a very collaborative approach with everything we do here at Ivy. And that is unique, as I have not experienced that at other organizations. So having someone join that really believes in the Ivy culture and wants to be part of that, we always talk about our one Ivy. It's a real thing. So that is an important part of the interview process, and discovering and uncovering if the Ivy way is going to be a good fit for those individuals joining the organization.
Thank you, Leah. And just shifting gears a little bit about, kind of continuing the growth conversation, and how we push our teammates to always strive to, enhance their education. Ivy offers a wide variety of residency programs and continuing education courses. So how do these opportunities prepare therapists to collaborate better in clinic?
Yeah, I can take that one. Our pediatric residency and fellowship program, so the speech, OT, and PT one, work really closely together. Jill, Kate, and I, have constantly are in communication with each other about, how are your curriculum lined up with mine, and how we can promote that interdisciplinary collaboration. And so part of that is holding 2 interprofessional weekends through our residency and fellowship programs. And so one at the beginning of the year and one mid-year, where we all come together in person and share space to talk about roles and responsibilities, clinic culture, leadership, and how to build that vulnerability within your team to create that success and growth. And I can say I walk away from those weekends with my cup filled, because it's so great to see these clinicians bonding and working together and over shared problems that they're like, oh, I thought that was just my clinic. I thought that was just my area. But knowing that you have this wide network across multiple states, that, these your cohort, your peers become more than just that. They become friends and colleagues for life. My cohort last year, who just graduated, they still are all in a group chat together. I think they just went on a vacation together. So, it's something where it creates these lasting, lifelong friendships and relationships that can only help grow and expand you as a clinician.
Oh, I love that. That one Ivy is definitely stretching across all our company. And then Jill and Kate, do you want to add anything to the residency program culture?
I'll go first. We both unmuted at the exact same time. just to kind of go back to what Brittany said, it's kind of been something that is very unique to Ivy that we offer. And as we've gone through years of growth and change, and like Brittany said, being vulnerable and leaning into what that might look like, really kind of leaning on each other's disciplines. So when we do have these interdisciplinary weekends, we have a speech therapist come in, and then we have speech therapists take OT courses, and then we take some PT courses. And so kind of having everyone learn the same content together. And back to what you said about the one Ivy, I know my cohort too, they would have never had the opportunity to connect with people that live in Michigan or people that live in Indiana, people that live in the Northeast. I'm in Virginia, so we're kind of everywhere, but it's fun to see all those connections being made, not just geographically, but then across disciplines. So when you have a tricky patient, you have your OT and your PT in your clinic, but you then have someone from a different clinic or a different region to be like, hey, what do you think about this? And so just to be able to have that collaboration and to be able to have that, friendship and also that trust. Like, we're really big about building trust and keeping a safe space for everyone. I think it's just something that we're all really proud of and have worked really hard to get as a part of this program. And it's been really fun to see it come together and then continue to grow year after year. And like Brittany said, they still have friendships, they still have group texts. The three of us are constantly talking. It makes work a lot more fun. And you can lean in and then just really kind of get the best outcomes, not just for yourself, but for your patients too, which is fun.
And I think I can speak from kind of an interesting perspective. I was a resident in the first residency cohort, and then I took a year to take my board exam, and then the following year I served as a mentor in the residency program. And then fast forward to now, where I've stepped into the director role of the program. So I've sort of experienced it all from different points of view. And 100%, yes, you are surrounding yourself with like-minded clinicians, not just in your discipline. So like-minded clinicians, OTs, PTs, SLPs, all together, who want to get better, who want to grow their skills. And there's something really powerful about being surrounded by people, that have the same mindset as you. And it really does, just, I think, give you like a nice foundation of people who you can trust, who you can reach out to, who you'll always be connected to. And kind of on the other side of that, I think it really teaches you how to talk to other people, in different disciplines as you. So you have that kind of like safe space of residency, you're talking to other disciplines. And then as you kind of like branch out and maybe get a little bit more confident and start kind of poking your head into the other disciplines and collaborating and talking more, you're doing so in a more confident way. And that can spark a lot of things in other people too. So I just think that it's really awesome to see the power of not just our residency programs, but that interdisciplinary model kind of all come together in more ways than, just obviously making sure that our kids get better.
Thank you. Thank you all for sharing. And congratulations to the three of you for leading such an incredible residency program, because truly everything I hear about it is just everyone's glowing and they're always so happy to talk about it. So thank you all so much. And Leah, jumping into, our culture and recruitment, from a recruitment perspective, what traits or experiences do you look for in therapists who are going to thrive in an interdisciplinary clinic model?
So from an experience perspective, it really depends on the unique position. If they are going to be joining a larger team, then maybe we could support a clinician that is a bit greener, so to speak. On the other hand, if it is a smaller team, we may be looking to identify someone with a deeper level of experience. And then as far as traits go, it's important for my team to look for individuals that have a desire to be part of a collaborative team, and also very passionate about being clinically excellent. And particularly in the PED space, we also want to make sure that there's a strong desire to work with the pediatric population, because that will be their day-to-day. So it varies depending on specific position, but the clinical excellence piece never changes no matter what position it is. That is very important here at Ivy.
Absolutely. Clinical excellence is a daily word around Ivy for sure. And how would you explain the Ivy difference to a candidate considering a position here?
So this is probably my favorite thing to do because, as I mentioned earlier, Ivy is special. So first off is the people. We work alongside exceptional clinicians that share, of course, a passion for clinical excellence. I know we've heard clinical excellence about 20 times on this call. And fun fact, we just had 42 new board certified clinicians, which is phenomenal. I'm sure most of you on the call know 11% of all PTs and 3% of OTs in the US hold board certification. So we're very proud of these individuals. And these would be your peers if you were joining Ivy. And then also we have a great opportunity to support your growth as a clinician. We've already discussed some of the residencies, fellowships, specialty programs. We have other training and development programs. We have our clinical career ladder. There are opportunities to open your own clinic. If you're on the peds space, you could transition to ortho, or if you're on the ortho side, you could transition to peds. You could grow into leadership roles. If you're a clinical nomad and want to experience providing therapy across different states, you could join our internal travel program. There's just a wide variety of offerings at Ivy that truly make us special.
Thank you. Yeah, the possibilities are endless for clinicians here at Ivy. And I know we briefly touched upon the importance of networking early on in the call, and I want to direct this question to everyone. When you're out networking and interviewing students, how do you typically interview them, and how do you look for those potential teammates when you're out in these networking events?
Do you want to kick us off, Leah, and we'll chime in after you?
Absolutely. Yeah. So my team, we go to a lot of events. Most of the national conferences we are at. So networking is just the name of the game in recruiting. So it is hosting happy hours, hosting various, what was it at CSM? The education session, hosting breakfasts. We're looking at some new and exciting things for our director summit. So potentially more to come on that. I don't want to give anything away, but it is a very important piece of just not only developing your personal network, but identifying those clinicians that you would want to come and be your peers, that you feel confident will provide the care that we need to make a difference in our patients' lives.
Yeah, I'll chime in off of that. Like being at the national conference for AOTA, having students come up to the booth who are curious, like, what do you guys do here at Ivy, and who come in with an open mind, right? They don't pigeonhole us if they don't know exactly the name, or they're maybe not in the geographical location of where we're at, but they're curious. And so that's a big draw for me, for someone, as a teammate and a clinician and a friend and a peer, is someone who's open to learning new things, trying different things, and being just open overall, which makes a great teammate.
And I would say kind of similarly to that, just kind of starting off at the basic level, like, can you talk to people? When we're at these conferences, when we're at booths, are people approaching us, or are they kind of shyly walking by, and do we have to kind of stop them and get their attention? Because, again, we work in peds, talking and having fun, and just kind of being silly is what we do all day. So, for me, I know, in my time as a clinic director, when I was looking at hiring and bringing people into the team, I wanted to know, could you talk to people? Could you kind of keep the conversation going? Were you curious and ask questions and trying to learn, as we were talking? And just, how comfortable are you in kind of an unfamiliar situation? Because I think that, that will tell you a lot about a person too, and their ability to withstand a child-led session.
Yeah, I think too, going off all of those, I remember I was interviewing for a PC position in my clinic, and the girl that accepted it has gone and moved up in Ivy and is an amazing. But the reason she chose our clinic and said yes is because everyone was happy and smiling in the interview. So it's not just about, what we're talking about, like the specific interview questions, but just kind of like getting a vibe. Like kids know your vibe. I feel like pediatric therapists know a vibe. Like we are all the same in some way, shape, way, shape, or form. And so just really being able to pick up on that, and we're just really looking for that positive impact, like Jill said and Brittany said. I think it's great to know, can we talk to people? Are we able to have fun at all these PEDS conferences at ASHA? We have the pop balls, we have the fun pens that are feely, we have stickers that everyone loves. So just kind of really looking again for that fun, energetic, because a lot of these families, right, their day-to-day might be kind of challenging. And so for us, it's an opportunity to kind of have them come in and take on some of that challenge for them for a little bit. And it's not easy, but we're all in it because that's what we love to do. And so just being able to kind of find people with those same similarities, and characteristics, I think is really what we're looking for.
Oh, beautifully said.
Real.
And I was going to say that the positivity from PEDS is always infectious, even on virtual calls. You guys always have the fun backgrounds and you jump into the calls with a big smile on your face. Like you always see that positivity and that sunshine radiating off of that team. So amazing work, guys. And, so not only do we like to have a lot of fun in our clinics and work well together, and we have those vibes, as Kate's saying, but we also invest in our clinicians. So I want to ask, how is it that Ivy invests in the clinicians?
Yeah, this is a great part of Ivy, and what drew me to Ivy in the first place. And so Ivy really puts an emphasis on continuing education, with all clinicians receiving $1,000 of continuing education as a full-time therapist, and even as a new grad, straight out of school, getting $2,000 of continuing education as a full-time therapist. And so that's unheard of in this space. It's these continuing education courses, they're amazing, but they're not cheap. And so coming out of school, whatever your financial status is, it can sometimes be hard to take on these courses, with thinking about student loans and things like that. So this is a really great opportunity to kickstart your career if you're a new grad, or, if you're coming from ortho to PEDS or from a different setting, to really lay that foundational knowledge and then be able to take some of those more advanced courses that might be out of your day-to-day budget. And then, like Leah alluded to earlier, we do have a clinical career ladder that we want clinicians to level up. And so with that, you earn more continuing education money for each level that you climb, all the way up to $2,500 of continuing education for our highest level. So we really, Ivy really invests and really wants you to utilize this money to continue to grow and be at the top of your license, so that we can see those meaningful changes and outcomes in our day-to-day practice.
Amazing. Thank you, Brittany. And Jill, I know that we had briefly spoken about student observers and how your region is someone who, really encourages that. So can you talk a little bit about that and how students can apply or reach out to you to participate?
Yeah, absolutely. So, when you say student, it really does mean student, kind of at any level. But I think, if we start at the obvious level, graduate students, my region, I'm located in Michigan, but my region, we're really big on taking students, PT, OT, speech students, for their different clinical rotations. First, it makes us better clinicians when we teach others, but then it also just allows for us to kind of grow our network of clinicians, and as the expert clinician, I can help start to kind of lay that foundational groundwork with these students early on, in hopes that, maybe they'll become an IV clinician with me someday. But yeah, so we place a big emphasis on just taking students in general, again, grad students for our 3 disciplines, but also student observers. I have had a slew of undergrad students who are considering PT or OT, just wanting to come in and observe. And we're always for that. There's really no better way to understand what we do on a day-to-day basis, other than just coming in and seeing it. And so, if we can kind of be that spark for a student to let them know, oh yeah, wow, this is pretty cool. This feels good. I think I do want to do this. Or, maybe on the other side of that, where, oh, I thought this was going to be a lot different. I'm not sure this is the thing for me. But really just kind of opening up the clinic and our knowledge and our expertise to those who want to learn about it.
That's amazing. Thank you. And so let's say someone's watching and they are convinced they need to take the first step into applying to Ivy. So, Leah, what would be the first step that an individual would need to take?
The first step would just be going to ivyrehab.com, and they can find our career site. They can also review a ton of different resources about all of the unique ways Ivy is special. There's a wonderful culture book on there that really highlights Ivy's culture, talks about our mission, vision, values. So first step, ivyrehab.com.
Perfect. Thank you. And we are reaching the end here. So I do want to ask everybody, what is one piece of advice that you would give to therapy teams looking to strengthen their interdisciplinary collaboration?
I mean, I would say, just lean in and make space for it. You really can't strengthen something if you don't practice or, try it over and over again. So just really kind of making a point to make space for the communication, that we talked about, whether it's coming up with a schedule or whatever it is. But I think it all starts there. You've got to make the time and make the space to really start collaborating and communicating.
I would say don't become stagnant. Always continue to try new things and kind of peek behind or around the corner on what new and exciting things, for lack of a better word, are happening in your space so that we can continue to be the leaders in pediatric therapy.
Yeah, and I'll say, I think imposter syndrome is huge in the pediatric realm. And so, going back to what I said earlier about how you can almost silo yourself just unintentionally, but being vulnerable, saying, hey, I'm, to your colleague, I'm just not sure about this, or can you tell me more? I was wondering if are all great ways to start a conversation that can open the doors to a lot more knowledge and your skill set. And so I just urge clinicians, if you're feeling, that imposter syndrome, know that the person next to you is probably feeling it too. And, open up that door and, collaborate together. And I'm sure it'll be a world of difference. So.
I think too, to wrap it all up, to continue to be curious and be vulnerable and leaning into that, and also not being afraid of what you don't know. I think we're all scared to say, I don't know, but being able to say, I don't know, can you tell me more? I want to learn more about this. And I think just really being able to lean into that and kind of have that confidence. It's not, I think we come out of school thinking we know all the things, and then you work for like an hour and you're like, I know nothing. But really kind of being able to lean into that and want to learn more, and then ask just not your same discipline, but other disciplines too for help and support, again, because we're really trying to work on those families and those patients and help them in their daily life. So again, if we can all learn and lean in a little bit together and be curious, and again, not be afraid what you don't know, I think that's where I would definitely recommend starting, kind of touching on what everybody else said.
Well, thank you so, so much, everyone. That is a wrap on this month's episode of Clinically Speaking. A huge thank you to Kate, Brittany, Jill, and Leah for sharing their perspectives and showing us how powerful true collaboration can be in the clinic. And of course, thank you to all of you for those of you who joined us here on LinkedIn. Your comments and questions keep these conversations going even after we sign off. Don't forget that you can rewatch today's episode here on LinkedIn and on YouTube, and be sure to follow us so you don't miss what's next. We will see you on September 25th, so make sure that you mark your calendars. We cannot wait to keep the conversation going with you. Thank you again for tuning in, and we'll see you next month on Clinically Speaking.